Good morning, good morning. It's a beautiful morning today. I can see there's a lot of cloud cover, but these are disappointing clouds because it's not going to bring any rain. But this is the type of weather you need for walking, particularly long distance walking. The temperature outside is 18 degrees Celsius, so it's quite nice and mellow for walking. Today I'm going to talk about the mighty hip joint. The hip joint. This is the biggest, the most powerful joint in the body. It is between the pelvic bone and the thigh bone. It is a ball and a socket joint. The socket bit is on the hip bone, covered by a structure called the acetabulum. For me, a little cup. The ball bit is on the thigh bone, going nicely into the socket. Obviously, if there were no supporting structures around this joint, it will just dislocate quite easily. So you have very powerful ligaments that join the thigh bone to the pelvic bone to keep the joint stable. In addition to that, you have muscles around the joint. In addition to that, of importance, there are what you call bursae in the same areas. We have bursae in some of the muscles at the back. Those we discussed earlier. Let me just talk about the muscles first of all. Okay, at the back you've got the gluteal muscles. There are three of them. You've got the gluteus minimus and gluteus medius and the mighty gluteus maximus. They come and give stability to the joint at the back. Now on the side of the joint, you have a muscle called tensor fasciae lata. This is the muscle that I call the gunfighter's muscle, because that's, like where the holster of a gunfighter in the Wild West used to be. So that's why I call it so. It's joined down to the knee joint by a structure called iliotibial band, which is just a bit of tissue, like a lota in other words. Now, on the inside of the joint, very deep inside, you've got a muscle that is called the iliopsoas muscle. The muscle has its origins from the pelvic bone on the inside and the lower part of the vertebra, the lumbar vertebra. So the two muscles join together, the iliacus and the psoas, hence the iliopsoas muscle. Then it's joined to the bones by tendon. Other muscles of note are the ones in the front of the thigh, the quadricep muscle, the biggest being the rectus femoris. And at the back, you've got the hamstring muscles. The biggest, once again, is the biceps femoris. So these are the type of muscles that are actually surrounding the hip joint. Obviously, muscles are joined to bones by tendons. I've said this before. Now, I spoke about bursae in the gluteal muscles before, at the back. But around the hip joint, there are two bursae which are of importance. Remember, bursae are fluid-filled sacs that helps in lubrication around the joint. There are two important bursae, in addition to the ones at the back that I've already spoken about. They are the trochanteric bursa. The greater trochanter is the part of the hip bone at the top. The thigh bone at the top on the outside is a big area, a bit of bone. So close to that, you have this trochanteric bursa. On the inside, in association with the iliopsoas tendon, there's another bursa called the iliopsoas bursa. It's just underneath the iliopsoas tendon that goes into the lesser trochanter on the inside of the hip bone. Now, from the previous talks, you will know that the pathology in this area that gives you pain is just the same. It's muscles, tendons, ligaments, and bursae. So, before going ahead, I forgot another group of muscles which are called the adductors, the adductor muscles. The adductor muscles, those are the ones that pull the thigh bone towards the center. There are four of them: the pectineus, and the three adductor muscles, longus brevis and magnus. So those are the muscles that I had forgotten. So you will get pain because of the muscles when they get a strain, because of the activity you're doing. I've already spoken to how a muscle strain happens. You get a bursa can become inflamed, you get a bursitis, in this case a trochanteric bursitis or the iliopsoas bursitis. The tendon in that region can also get strains, the iliopsoas tendons, the tendons of the adductor muscles, the tendons of the gluteal muscles. So basically the kind of pain you will get will be strains, ligament strains as well. The ligaments that are holding the hip bone in position can actually cause pain too. Finally, the hip bone is a synovial bone joint. This is the hip bone is a synovial joint. Therefore, you can get a synovitis or an arthritis deep inside the bones. So in summary, the kind of things can cause you problems in the soft hip problems are: number 1, bursitis; number 2, tendinitis; number 3, muscle strains; number 4, ligament sprains. I think that's all there is to it. So a physician should be able to examine you very carefully to tell you which of those structures are responsible. With regard to deeper structures, I think you really need to see a specialist because they're very, very difficult to ascertain what the problem is. A lot of the times I see patients that have been going to see physiotherapists for 30, 80 sessions and they've not got better because the diagnosis was never established properly. So that's the hip joint. It's a fantastic joint. I love dealing with it. Treating problems, particularly for the deeper structures, it's not very easy. You need guidance. You need ultrasound guidance. Sometimes fluoroscopic guidance. Fluoroscopic guidance means you're using X-rays to pinpoint the area which you want to put medicine in. Enjoy yourselves, folks.